Have a good day, friends. This is Professor Yamini Bhushan Tripathi. Again, I am coming to a new topic in palliative care, that is yoga and exercise in palliative care. You know that a person, elderly, chronically ill person, is physically inactive, mentally depressed. So, as a palliative caregiver, our duty is to make him active, make him happy, and make him eager to eat. So all the three things make him good quality of life. So today I am going to talk yoga and exercise. You know, old man cannot do exercise very much, but I have given this type to understand you. So yoga is the best way to engage him physically and mentally. So if you are a palliative caregiver, you should know the intricacies of yoga. There are Ashtanga yoga, Yama, Niyama, Asana, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. There are 8 branches of yoga. So you should have some knowledge of it. And there is a different class on yoga. I will teach you. But here I want to tell you what is the holistic approach of yoga in palliative care. So, first of all, try to understand what is palliative care. It is a misconception that it is the end of life care. No, it is not end of life care. Palliative care can be given the moment physician knows that the disease is not going to be cured. The medicine will go all along his life. The physician should refer his patient to the palliative care. So even in the very beginning, the sooner you refer, the better is for the patient. Ultimately, because he will get depressed, because he knows, when he will know that disease is not going to be cured, he will get depressed. Then it will be too late to revive them to the mainstream. So it is always better. And main problem that doctor doesn't refer to the palliative care unit, and the patient keeps on struggling with the mainstream of medication and keeps deteriorating his quality of life. So the truth is, the end of life care is the subset of palliative care. It is the end of life, it is near. A man can live 6 months, a man can live 6 years. But for the 6 year palliative care can be given, and for 6 months also palliative care can be given. But it is not in totality. So palliative care is a disease modifying treatment. It is not a treatment of disease modifying treatment, and can be initiated even early in diagnosis if the disease is progressive and has a chance for complication in future. Suppose you know that the disease will not be cured, and in future it may develop the complications. So why not to start? Prevention is better than cure. So palliative care also gives a kind of preventive measures. And your whole body, it takes care of the whole body. Body is a one system. If your system is strong, your disease recovery prognosis may also be better. So one has to think of it. So WHO and Indian Association of Palliative Care also recommends early integration of palliative care into NCD management plan. It is a accepted rule by World Health Organization, but people are not doing it. So with this lecture, I wanted to tell you that don't feel it is the end of the life management. It is any time you can start. So mindfulness therapy may be helpful. It enhances the awareness and emotional regulation. It is used for reducing stress, anxiety, depression, chronic pain. Pain is the main issue. The pain is linked to your thought process, your mind-body relation. If you want to manage the pain, you cannot only depend on medicine. You have to depend on his mood also. If his mood is good, if serotonin and dopamine hormones are coming properly, the pain will automatically get reduced. He will not feel pain. He will not feel pain. To reduce cognitive clarity, positive and self-awareness. So body relaxation by yogic process, pranayam, focusing on the respiration, meditation, spiritual therapy by chanting mantras and music therapy, etc. can achieve these goals. So mindfulness therapy is very important, and in this case, yoga plays a very important role, very important role. So palliative care, what is the objective of palliative care? It focuses on the improving the quality of life and can be provided alongside the curative treatment. Main treatment, let it go, it is fine. But along with the treatment, the quality of life should not get deteriorated, and for this, palliative care is very important. Second is, it is not limited to end of life, as I told you earlier. It is applicable to individuals with chronic and life-threatening illness. So NCDs are most of the life-threatening, means it go along with your life. So it is better to be in touch with the palliative care provider. Method of care varies with age, type of chronic disease. So all the diseases, I mean, for man is the same, but diseases are different. Somebody is having diabetes, somebody is having hypertension, somebody is having heart attack, somebody is having paralysis, somebody is having cancer. Different diseases. Somebody is having Alzheimer's disease, is different. But the age, most of the time, they are elderly people. But in some cases, even young boys, suppose a congenital heart disease is there, or some rare disease is there. So a young boy can also be and his life is fixed. Maybe 10, 15 years, then he will die. But in that case, palliative care should be given to him. So age is very important. But age of the patient and the type of chronic disease. So different age groups have distinct needs based on the symptoms and the psychological concern. When should a patient with NCD be referred to the palliative care? This is very important. When the patient should be referred, the focus shift to relief of the symptom. Symptom like pain, breathlessness, fatigue, anxiety, etc. Despite disease-directed treatment. Treatment is going on, but still the person is having these kind of things, then relief in symptoms is important. Improving the quality of life, experiencing significant functional decline or the complications in the chronic disease, then improving the quality of life. Psychological and spiritual support, progressive disease with limited treatment. Treatment, you know, there is no treatment. People say there is no treatment for it. You have to live with it. So live with it means how? The quality of life and the mental state should not be compromised. You have to take care. And shared decision making and goal setting. High financial treatment burden outweigh benefits. Benefit is less, but the expenditure on the treatment is very high. This also makes a psychological disturbance in the family, in the patient, both it has taken care. And frequent hospitalization. If the patient is frequently being hospitalized and visiting emergency unit, then palliative care is applicable. Need for psychological, social and caregiver support. These are the conditions when it is given. The palliative care referral, you know, this is a flow chart, I have already told you. So if these are the conditions, you know, does the patient have a chronic illness? Then are these indications present? As I told you earlier, symptom burden, activity decline, emotional stress, treatment fatigue, goal shift and social challenges. Then yes, palliative care. Here, yes. And then discuss with patient and the family because of the financial burden you have to look out and refer to the palliative care. This is the flow chart. And then age for palliative care, children and adolescents can also the chronic conditions like the congenital heart disease, childhood cancer, neurological disorder, adults, symptoms and burden of NCDs, non-communicable diseases, as I told you, blood pressure, heart attack, paralysis. Older people, multiple NCDs, frailty, chances of falling down because of the muscle loss and you become weak, you are frightened to move, you may fall, and cognitive issues. So child, adult and old, all the three need palliative care. They can be given. So palliative care in metabolic syndrome. What is metabolic syndrome? There is a group of diseases. It's diabetes, obesity, hypertension, diabetes and heart disease. Hyperlipidemia and heart disease. These things combined collectively called metabolic syndrome because the cause of disease is the same, obesity. If first obesity will come, then disease will appear. So we have to take care of it. The palliative metabolic syndrome, why needed palliative focus? So advanced heart failure, refractive symptoms and poor prognosis, relief in dyspnea, fatigue and psychological support. End-stage renal, ESRD, end-stage renal disorder, people go not able to go for dialysis but they are having ESRD. They are going to die after some time because the dialysis is also not effective. It is very expensive also, many people cannot afford. So multiple comorbidities, functional status poor, and then pain and symptom management, supportive decision making. Post-stroke, if paralysis has taken place, then dependency and cognitive decline is there. So caregiver support and quality of life. And diabetic foot, you know diabetic foot, what happens? You have a ulcer in the foot and it is not heal. It does not heal. So diabetic foot is very serious disease, and sometimes it develops into gangrene. You have to amputation. Foot amputation is also there. So we have to take care. Pain, risk of amputation, and poor healing. So pain control, wound care, and emotional support. All the three things are our goal. Obesity with limited mobility. If a very obese person cannot move, and a lot of complications, as I told you, obesity is the mother of metabolic syndrome. So breathlessness, fatigue, and social isolation. And comfort care, counseling, weight-related symptom management has to be given. Refractory hypertension, risk of stroke, heart and kidney failure. Risk communication, symptom control. And multiple comorbid with the frailty, frequent hospitalization, goal setting, care coordination, and advanced care. These things are there. Now I'm coming to the yoga. Geriatrics, a medical specialty focused on health and care of old people. Palliative care is a specialized approach to improve the quality of life for individuals with serious chronic or terminally ill by addressing physical, emotional, and psychological disease. Yoga is a gentle, stress-reducing, and supportive emotional well-being, as I told you earlier, ideal for frail seniors and palliative care. And exercise strengthens the muscle, bone, and cardiovascular system, helping older adults maintain independence. But if you are a bedridden person, it is very difficult, but this is the option. But if you are a little earlier than that time, then if you can afford to do exercise, we should promote exercise activity. And combining both can provide holistic benefit, physical, mental, and emotional. So you see, this is this cartoon I have made, yoga poses for palliative care. Supta Buddha ye, yoga poses, baby pose. So that has to be taken. Chair pigeon pose, thread the needle, seated forward bend, and Supta Buddha Konsa. So as I told you, there are 8 branches of the yoga: Yam, Niyam, Asana, Pranayam, Pratyahara, Dharam, Dhyan, and Samadhi. Yam and Niyam is the ethical restrictions, and this is the social and personal hygiene. And Asana is the physical activity. And Pranayam is the lung, respiratory control, that respiratory system. And these things are your brain, psychological. So mind-body relation, this body. Mind-body relation can be achieved by 8 limbs of the yoga. So tools to improve the mindfulness, as I told you in the first slide, mindfulness is very important, and reduce the anxiety and insomnia. Insomnia, you know, the loss of sleep. Sleep quality is deteriorated with age, and that has to be controlled. Because as I told you, Ahar, Nidra, and Brahmacharya, the 3 pillars of the good health. Nidra means sleep. If you are not getting good sleep, this is called insomnia. So breath awareness, body scan meditation, mindful walking, guided meditation by audio and CD, journalism, writing thoughts, emotions, and reflections mindfully. Write your old memories, good memories, and this is also very good. And mandala, coloring intricate pattern to enhance focus. This is also a way of coming away of anxiety and insomnia. And nature immersion, spending time in nature, mindfully observing surroundings, and gratitude practice, listing things one is grateful for the day. Every day you should write. Okay, suppose you have a good day, pay gratitude to your family members, pay gratitude to your God, to your friends who have met you all the day, who have given you food, who have given you a company. So you should feel gratitude. Once you remember the whole day, a reflection of the activities of the whole day makes you happy and then out of the anxiety. This is very important. So these are the some tools which I told you to improve the mind. So Yam, I told you as a social ethics. Yam means how you should behave in the society, and Niyam means how you should behave with yourself. So Yam, Ahimsa, Satya, Asteya, Brahmacharya and Aparigraha. These are the Yam. And Niyam is Soch, purity, contentment, discipline, disciplined life, self-study and surrender to God. The same thing as I told you in the early beginning, gratitude. So Yam Niyam is very important. You know, most of the time in the whole world, the yoga day is being celebrated, but people feel that asana and pranayam is the only yoga. But this is not true. Yam Niyam is very important part. And people don't understand and then don't follow it. This is the time when you should do counseling for Yam and Niyam. If you do these two things, automatically your health and quality of life will improve. Yam means social health, Niyam and Pratyahar means mental health, Asana and Pranayama is physical health, and Dharan, Dhyan, Samadhi is spiritual health. So social health, mental health, physical health and spiritual health, all the things are covered by Ashtanga Yoga. You have to be careful. These 5 Yam and their parallels in different religions. You know, in different religions, similar activities have been recommended in different names. So I have made a table for it: Hinduism, Buddhism, Christianity, Islam and Sikhism. And yoga is come from the Vedas. So this is the fundamental. But these things have been followed by most of the religions in their religious gurus. They have given their preaching. But if I studied them, I found that all are rooted in this yoga, Ashtanga Yoga. So practical application of yoga in daily life. Practice mindfulness, number 1. Self-discipline, Yam and Niyam. Develop daily meditation, Dhyan, habit to cultivate inner stillness and detachment from the desire and or attachments to material, possession and expectation and ego. Detach yourself and develop a compassion for all beings. Yoga, Samadhi, liberation from worldly illusions, realization of pure self and achieved through meditation and self-discipline. So Ayurveda, Yam and Niyam, this is a slide I want to tell you. Ayurveda has 3 methods of treatment, and Yam and Niyam in Ashtanga Yoga, they are very much similar. Both systems, means Yoga and Ayurveda, restore psychosomatic balance. They prevent disease and promote overall health. They focus on self-disciplined life, purification of the body and mind, and mindful living. They are interrelated and offer holistic health care. And Ayurveda is based on the individual constitution, Prakriti. This is the genetic makeup of that person and disease condition. And yoga provides a disciplined path towards physical, mental and spiritual health. As I told you earlier, Yam and Niyam, moral restraints, and Niyam is the observance, aligns closely with Ayurvedic principles of Swasthvrit and 3 treatment methods. What are the 3 treatment methods in Ayurveda? Spiritual healing, psychological counseling and Yukti Vyapasya. Yukti Vyapasya, Sattva Vajaya and Deva Vyapasya. Deva Vyapasya means spiritual healing. Psychological means Sattva Vajaya. And Yukti means medicines and different methods of treatment. Yukti, apply some tools to treat the patient. Now this slide shows the comparison between yoga and exercise. Exercise, yoga. And scientific evidence, you see, Journal of Strength and Conditions, Psychomedical. These are the research publications which have been published. The body flexibility, main thing, the goal. Gland stimulation, endocrine gland. Waste removal from the body. Breathing and lung functions. Muscle engagement and blood circulation and digestion. So these are the goals They can be achieved by exercise, they can be achieved by yoga. So increases, you see, regulation of hormones, aids digestion, regulates breathing, and improve the lung function, engage both external and deep muscle. So both the things are doing the same thing. These goals are being achieved, but yoga is easy to do and it is more acceptable. And exercise is forceful. So what happens if you go to the scientific part, sympathetic nervous system is activated in the exercise like gym. If you go to the gym, this system goes high. And in yoga, parasympathetic, because asana pranayam is maybe doing a little this, but pratyahara dhara dhyan samadhi more sympathetic. The mindful living, meditation, the parasympathetic nervous system is activated. And this is the good part for your good health. And this is the fight or fly away. So run away from any challenge. If you're getting a challenge in your body, in your mind, every time, your sympathetic nervous system is high, which is not good. If you are always, it is a high condition, then not good. For a particular time it is high, it is essential for your body. But for whole 24 hours it is remaining high, it will cause you disease. So this is the problem. So exercise and yoga and immune system, you know that immunity of your body is very important. Why? It protects your body from infection and it also protects your body from all odds, like the non-communicable disease infection. Means your immune system, immunoglobulins are fighting. But in the chronic diseases like the blood pressure, diabetes, cancer, immune system is not important. The heat shock proteins are there. There are different protective and antioxidant enzymes are there. They should be properly active. Then only you can remain, prevent yourself, protect yourself from non-communicable disease. So exercise and yoga, improving your defense system. Effect on exercise on immunity, open window hypothesis, exercise and infection risk, lymphocyte redistribution, impact on aging, vaccination response, cancer protection and inflammation control. Exercise reduces the chronic inflammation, promotes better immune balance. Exercise enhances the immune surveillance, potentially reduces the cancer risk. Regular exercisers show better antibody response to a vaccine. If you get an infection, your body will be strong enough to fight with this. And exercise may slow immune aging and reduce the susceptibility of infection. Comparison between exercise and yoga. Yoga activates the parasympathetic nervous system. It activates the sympathetic nervous system. Forceful. Engage subcortical automatic meditative region and engage cortical region, and slow, controlled, dynamic and static. Yoga is slow, controlled, dynamic and static movement type, and it is a rapid and forceful. And the muscle tone normalizes muscle tone, enhances flexibility, increases the muscle tension and stiffness. Injury risk, low risk in yoga. It is high risk in yoga. Caloric consumption, low to moderate, is moderate to high. So effect and effort and breathing, relaxed, natural breathing, energizing effect. This is the maximizing effect breathing can. So muscle engagement, balanced activation of opposing muscle groups can lead to imbalance in muscle groups. Because the yoga poses are in such a way they have been designed that they involve all the muscles one by one. But in the gym, you are forced to do one exercise more, one exercise less. So not equal distribution of the, equal involvement of the muscles are involved. Competition, a non-competitive process focused, competitive goal oriented. So these are the things which I want to say, but in case of palliative care, I always prefer yogic practices are the only way we should apply. Exercise may not be effective, may not be recommended. Exercise affects the gene expression and influence the gene. You know, the epigenetic changes, you know what is happening? You have a gene, but gene will not be functional if it is suppressed or if it is not allowed to express. It means the conditions which control the expression of gene, they are called epigenetic factors. So they affect your gene. So that has to be taken care, and the gene activation, epigenetic changes, obesity and exercise, and brain and mental health. So these are the aspects, exercise affects. So you should be very careful that how it is acting. You see, this is a slide I have made. Yoga, exercise, mindfulness. They are the factors which are controlling epigenetic control. And if this is controlled, your gene expression is controlled. So epigenetic control refers to the regulation of gene expression without altering the undergoing DNA. There is no DNA mutation, there is no DNA cut, but expression is changed. So suppose you have a 100 rupees in your pocket, but you are not able to use it. Then it is of no use. The gene is there, which is not working. These changes are heritable, but epigenetics are heritable, the cell division. So that's in Hindi we say, जैसा अन्न वैसा मन, जैसा संग वैसा आपका behavior. So it means the way you are behaving, your environmental conditions, they are controlling your gene expression. So these are the biochemical terms: DNA methylation, histone modification, non-coding RNAs, and chromatin remodeling, 3D genome organization, and developmental programming. These are the terms which are involved in the epigenetic changes. So what I want to summarize, that your environment, your food, your lifestyle, your mood, they are affecting the expression of gene. And expression of gene is being affected by these are the 5 types of activities in your cell, in your body. So these has to be controlled by your lifestyle. How exercise affects the overall health? Cardiovascular health, inflammatory control, genetic influence, and genetic means epigenetic. Immunity boost, as I told you earlier. Cardiovascular lowers blood pressure, reduces the risk of heart disease. Inflammation decreases inflammation and improves immune function. Response is based on the genetic makeup. I told you epigenetic. Immune boost enhances the immune surveillance against infection. So exercise is affecting in all the way. So the take-home message is that in a palliative care, you should always think how you can involve mental and physical state of your patient. And this is a very compensatory. You have to have a compassion. If you are having a compassion, if you are changing his mood, then he will listen to you. You cannot force him to do exercise, you cannot force him to do yoga, you cannot force him to eat, but you can convince him. And that is the art. Patient listening and then understanding the desire of the patient. And accordingly, you recommend the yogic practices, the food habits, everything, whatever you want to do. So all the 3 branches of Ayurveda, as I told you, Deva Vyapashraya, Sattva Vajaya, and Yukta Vyapashraya. And all the 8 branches of yoga, Yam Niyam, Asana Pranayam, Pratyahar, Dharan Dhyan Samadhi, everything is saying one thing: maintain the mind-body balance. If that is maintained, the quality of life will automatically improve. Thank you very much.